is this a SaaS like architecture that is configuration driven, and so it's designed for agility and extensibility. To me, that's the core, right? Is I can take one use case, but then I can apply other use cases over time. And I think a true platform architecture is realizing that everyone's experience has to be different. And you have to have that architecture from the ground up. You can't add it in after. It's one of those one-way doors. We've got to have digital make sure it's supporting seeing the story and the journey of a patient.
All right, we are here at ViVe. It's always fun to get a little bit deeper into some of the topics and discussions in a one-on-one session. I love panels, and panels can go in really deep, but this one-on-one conversation is what we're really trying to bring out here. And the focus today is with Ben Maisano from Tendo, and also with a really storied background with past Chief Technical Officer role at Mount Sinai Health System in New York, Chief Digital and Innovation Officer role at Atlantic Health System in Jersey. Ben, just a quick hello or introduction, or any story on your background you want to share.
Yeah, thanks, Chris. Yeah, happy to be here. It's been fun in Nashville so far. Yeah, I've been kind of around the block at startups and health systems, and now just recently with Tendo back at startups. But I think I originally started my career at United, like building software, and so it was early on in healthcare. Did a stint in fintech in early 2010, 11, just when kind of mobile was taking off, but always kind of gravitated back to healthcare. My mom was a nurse growing up, so I kind of lived through her doing night shifts at the hospital, to like the pediatric unit, to like a pediatric office, and then a school nurse. So she kind of progressed to kind of more manageable jobs, but always kind of seeing that was kind of my first perspective before my career in healthcare. And then, when we were having kids again, personally, my wife had like an emergency C-section. I just went and witnessed the amazing, you go from like a plan that just gets thrown out the table and there's 2 clinicians in the room to 12. And they had our daughter out in 2 minutes and saved her life. And so thank God that worked out. But kind of that gave me this appreciation of like this amazing clinical environment. But as a technologist, I was always feel like the technology didn't like live up to kind of the clinical excellence that we have going on in the U.S. So really been on a mission of just seeing the parallels in other industries, whether that's fintech or you've seen even like what the travel and airline industry has done by just opening up a few data points, APIs, and had a lot of kind of more accessibility. It always just felt like healthcare had so many problems to solve anywhere you turned. And I've always just been a guy that goes after like a hard challenge.
Well, there's a huge amount at stake that in the industries that you're describing, but even much more so when we bring lives into the fold, and not just lives, but health, mental health, the well-being of the people that are delivering that care. Like it's the blessing that you grew up and have that influence of being the child of a clinician and having that influence some of your thinking and how you're enabling the digital end.
Yeah, I think it is. Clinicians have bared with like kind of, they've gone from this like no tech to tech being forced on them to being jaded about kind of frustrating tech and extra clicks. And I think we're finally getting to a point where we can focus on them as a user. We know it's a supply constrained industry. We know basically every good idea in healthcare is put on the back of physicians, clinicians, and I'd say nurses pretty much run hospitals actually too. And so it's always been more work, whether it's a new tech, an EMR, a digital solution, virtual care, value-based care, new models of care. It's all been put on the back of these clinicians. And so we've got to get to a point where tech is helping them be more efficient because they know how to help the patient. Mm-hmm. Like everyone's like patient-centric, patient-centric. Yes, you have to be. And we are at Tendo and always we're in the health systems, but clinicians are a close second because like they are going to be patient-centric if you enable them to be.
Yeah, like having their hands on the patients, not only having their hands on the patients, having like the closest path to empathy, and even like risk of losing licensure and things like that. There's all kinds of things that highlight the importance of listening to our clinician partners. So one major thing that I'm hoping that people get from this conversation is like your background in technical leadership at various health systems, and then combined with the stuff that you're doing at Tendo today. Really want to help address like how to cut through all the noise of thousands and thousands of point solutions, apps, be able to cut through the noise and think through how to enable these strategies, how to do this in a way that does help clinicians, satisfy clinicians and patients. Does that sound pretty lined up? I'm curious what you might want people to learn too.
It's a great question, Chris, and I think that's maybe starting at the work at Sinai. When I went from a pediatric startup and joined the health systems, a lot of it was this realization, I think, by health systems of, hey, I'm buying these solutions and it's like 60% of what I need, right? So then I buy another solution that's 60% and it didn't exactly even cover the 40% delta I needed it to. So now I've got two solutions and I still have this gap of what I really wanted. And it goes on and on like that. And that's why you'll have a portfolio of 300 to 1,000, like, basically vendors and pieces of software in a health system, because they can only kind of pick off the shelf. And so the idea and what we were doing at Mount Sinai, and a lot of great leaders there, Mount Sinai was 800,000 lives at risk, really competitive in a New York environment. And they kind of said, hey, let's start building and collaborating and really innovating in this space. So we spun up a team of engineers, product managers, designers, and some of the first hires were like UX UI researchers to kind of go out and talk with these users and like bring that mindset of product and user research into a health system. And so that was really rewarding work, and we kind of built up a lot of good virtual tools and even like kind of concierge and health and wellness access in New York. So I was always proud of that work, and I think it kind of showed, hey, it's expensive to build at first. It's like a 2-year upfront investment to really get going, but then there is big benefits because you're able to unlock that creativity, like that I think is the physicians and kind of entrepreneurial spirited folks in a health system are yearning for, versus always trying to kind of analyze the market and find this thing. Now, not every health system can go spin up a product organization. So, joining Atlantic during the pandemic, the idea was we created a venture studio, and it was like, how do you partner and kind of co-design and co-build with these great entrepreneurs out there? I think the assets a health system has, right? They've got patients, they've got doctors, they've got infrastructure. These are things that are huge assets to a startup, way more than capital, right? Capital you can get from VCs if you have kind of all the right pieces, but you still need these other things, right? And likewise, the startups in the world, they have this great product mindset usually. They're bringing the latest technology. They can move quick, and just that iteration is so important that health systems aren't really built for quick iteration. So if they have a partner that they can work that with, that was a really interesting model. Like, how do you actually stop this vendor customer thing and talk about strategic relationships and like co-design and let health systems really influence your roadmap and be a partner in that evolution of a product? That's how you're going to get to, I think, solutions that are more like a true platform. And we can talk about what a true platform means. And that's kind of why I joined Tendo, because they were really architecting and creating the platform I kind of wish I had at these two systems and would have had to do less building probably.
I can only imagine having been immersed in portfolios with 300 to thousands of different apps and things like that, like seeing something that you were attracted to and migrated to from a platform perspective. Now, when you talk about the teams and coalitions, you did talk about the fact that, hey, that might sound expensive to build up, but I think you painted a picture that a leader or organization can start seeing some value in, to start justifying going down that path. One thing that I think it would help arm people with is when you mention platforms. Everybody eventually, being in the startup world, I think that at a certain point, everybody realizes they need to be a platform. So you have a lot of people saying they're platforms, but not really. So can you help the audience out with the sniff test, the vendor whisperer? How do you suss out who's truly a platform and who's not?
Yeah, so I think a true platform, then you got to look at what are the characteristics. You got to get past this term everyone's overusing and say, hey, is this a SaaS like architecture that is configuration driven, And so it's designed for agility and extensibility. To me, that's the core, right? Is I can take one use case, but then I can apply other use cases over time, right? So you've got to have extensibility, which usually means configuration-driven workflows, right? Because think about why you have specialists in healthcare. If everything was the same, I would just have primary care doctors, right? I'd have one doctor that does everything. We have specialists for a reason, and because every condition is so nuanced. Every condition is so nuanced. Every person's journey is so personal. And so why would we think that you can have this rigid solution for that's not the reality of the problem? You're not looking at the real problem. The real problem is I need a personalized plan. I need things that are catered to each condition, right? If you think like what your patient portal looks like, I used to show a picture, patient portal for an expecting mother, patient portal for a person recently diagnosed with cancer, patient portal for someone that's healthy and looking at wellness, patient portal for a diabetic. They were all the same picture. And I'm like, how is this a digital solution for these people? So Tendo, and I think a true platform architecture, is realizing that everyone's experience has to be different. And you have to have that architecture from the ground up. You can't add it in after. It's one of those one-way doors. I think if you got to build it up right. Now you can decide how you sequence that, but that's kind of really important that you can add more workflows. So we're able to have people consolidate 3-point solutions into one. Tendo. And so I think if you can do that, that's a strong ROI case, of course. But you should have a command and control center. Like people can log in and see it and quickly make changes themselves. Like ultimately, we want to put the health systems in the driver's seat. That's an important, I think, characteristic of a platform. Those are kind of the big ones that come to mind. And then obviously you need a good security architecture for an access control system. You need to be data driven. So you kind of need these layers, right? You need the configuration layer, but you need the right just data model at these base levels. Then you kind of build up off of that. You need like an insights and orchestration layer, right? So no one's just coming to your platform either. It's like, how are you engaging and reaching out? How are you kind of using data to personalize along with config? So if you put data and config together, that's when you actually have a content personalized experience to me.
So when you were describing the multiple patient portals for different experiences within the health system, I think my phone exploded at the fear of having that many different applications to manage these different systems. So what the atmosphere, the environment that you're describing, is that looking at it from like a one vendor to rule them all approach, or is this like connecting multiple different specialist type systems and solutions into a platform play?
Yeah, I mean, I think health systems have core systems, right? Just like banking and airlines, right? They're going to have a core scheduling system. They're going to have a core billing system. They're going to have a core like clinical system. And if you think so there's a lot of these back office systems kind of exist and we tack in solutions around them. I think there's a kind of a lack of a central front office system, right? That covers you at the top of the funnel when people are just trying to figure out, what do I need? They don't know what kind of doctor they need. They want to be kind of triaged and just discovery, right? Before even access. So you need discovery, you need access, you need kind of that elongated journey managed. You need what is the next evolution of the access center, right? It can't just be the call center, and it can't even just be what's traditionally viewed as, operational. Like what is the kind of clinical front office system that supports the whole operation of the front office of a health system? I think that's kind of what we're looking at.
So the idea of the front office system is to enable the type of experience that an end user, clinician, patient might need, like given their context, but allow like the best applications in the back end to do it. So it's not just one approach, one company that owns all these approaches, but it's a connection of where different endpoints need to touch.
Yeah, you've got to be collaborative in the ecosystem. You've got to be able to let people integrate. You've got to integrate with others. Like if you don't play nice in the ecosystem, I don't think you're going to do well in healthcare. And so you can leverage the latest interoperability and standards. You've got to kind of know that ecosystem and how to connect and also be friendly with others because, health systems it's a hard job. These chief digital officers or any decision makers, CIOs, clinician leaders, operational leaders, trying to figure out what solution they need to synthesize all this, right? They're ultimately running their platform. We can say we're coming with the platform, and we can, and I think being more strategic and aligning with them is a way to go, but you've got to be able to still piece together and integrate kind of bi-directionally, and both sides. I think it's important. Like, Tendo kind of focuses on being this trusted connection between the patient and the clinician. So there's another side of thing, right? You're going to go automate a survey and collect some data. Someone's got to look at that, and if you did that for 1,000 patients, you've got to know which one do I need to look at first. So you've got to kind of know the workflow. I think is more important than just kind of in each individual user's experience. It's like it's a team sport, right? So if you're not designing it for a team sport, I don't think you're going to have the right platform. And that kind of gets to kind of the last point I'd say is it's ridiculous how big of a lack of family organization there is in digital solutions. Like when you have a health issue, God forbid, your family's involved. And almost no solution is built around a family experience. How easily you can share and organize around a family, not just a patient. But in reality, your family's involved. So why aren't they involved digitally? And so I know for myself, like I have one of my child's records, my wife has two, and none have our fourth child. Like really, we don't know where she is digitally. And there's a lot of people like that, right? And then, sometimes when your parents are experiencing, they don't exactly know how to convey everything they heard at the doctor's office. So you've got to be thinking patient, clinician, both the workflow and the family unit, I think, to get it right.
Yeah, and often it's very hard to happen without a family. So having some enrollment, because like your family members, with your mom being a clinician, like she's going to be involved in these healthcare scenarios, but there's not a digital way that helps with her position in that navigation in a lot of cases.
Yeah, it's just lacking. I mean, it's you really need to kind of share and be able to discuss it, and that brings comfort to everyone. I think it raises outcomes drastically if families involved efficiently.
So one thing I wanted to get into is the impact. So like earlier we talked about kind of that business level strategic impact, at the very least, getting away from the headache of these gigantic portfolios of solutions that don't address the problems. Are there some examples that you can think of, or just a single, like any example that you can think of where there's been a significant impact on the clinician experience that doctors, nurses have had an easier go based on like a solid platform play?
Yeah, I think if they have a platform, what physicians can do is almost like personalize it to their needs, right? And it feels like it's working for them, not against them. So if you're able to reduce clicks, if you're able to give them the right insight, like a lot of the EMRs are essentially architected in a visit-based architecture, right? It's this point of time, it's this point of care thing, and that's what healthcare had to do in the beginning. It's like, hey, this is you're here, you're in my office. I got to get your vitals. I got to do this. This is how billing works, is encounter based, and that's missing the elongated story of the patient. So I think where we're seeing clinician value is if you can help them organize that story and see that story, and not just be focused on the person right in front of me. Because in reality, I read a stat. It was like you see a doctor actually meaningful, engaging talking time about 12 minutes a year. Right? And so it's so little. And in reality, like health is daily and health is longitudinal. And a condition or a journey or an episode of care, and you're seeing the new models of care and how you pay and measure that looked at more as an episode and a journey now. And I think that's a great move. We've got to have digital make sure it's supporting seeing the story and the journey of a patient. And so it's multidisciplinary, it's multi-step, it's elongated. It's not the 12 minutes at the office. That's that's valuable time, but that's not really where sick care or health care is actually happening.
Then, so you mentioned the patient here. Could we talk a little bit about the advantages of that single platform play? Like maybe they're not in these systems every day, but what would you say are the advantages that go downstream to the patient as a result of these platform thinking and strategic moves?
Yeah, I mean, I think it should be more useful, and it's not just, hey, I'm doing a booking online over here, and I'm getting this other thing for my bill pay, and nothing's helping me manage my meds, and I have like a PDF about my care plan. To like that's all got to change to feel integrated, to feel as one system, and to feel connected with the health system. Like it's got to be a relationship. The leading physicians and the great practices that I've talked to, and this is not from me, it's just hearing what they want to do. They want relationship-based medicine, and like I loved hearing that, because like you don't feel like you have that all the time, but I think that's what clinicians want. So whether there's been this move to bigger systems and now maybe a move out, and I think clinicians are feeling that out now with the growing administrations and the growing complexity, they still want to practice relationship-based medicine. So the right platform and the right digital solutions for the patient should make it feel like that. And that's not easy to do when you're kind of have to grow your patients all the time. You have to comply with all the overhead, and you have to run ROI of running a practice or running a health system is tough. And now you have to establish a relationship with thousands of patients. So you need help digitally.
So I think that you've given a good overview on how to think through certain aspects of digital strategy and think through platform versus point solution mentality. Just want to finish it up with one question, which is, we ask this of every guest. If there's one thing that you could change about the way healthcare is delivered in this country, what would that be?
Whew. Just one thing, huh?
Just one.
Yeah, obviously how it's paid for complicates a lot of incentives, right? If you reimburse something based on the complexity and the time it takes the doctor, and if I innovate and make it faster, right? And I say I take something that's a procedure that's 30 minutes, and now it takes 5 minutes with a new innovation, and that means they're going to get paid less. Tell me how to wrangle that equation, right? So you've got to be able to like pay and incentivize everyone based on the value. That's what we happen everywhere else. Like as a consumer, right? You pay for things based on value, not how long it took the manufacturer to make something.
Yeah.
Right. But in healthcare, they actually come up with reimbursements based on like length of procedure time and complexity and things like that, and then you can extrapolate that to a lot of other areas where I'm paying for quantity. You do a visit, you get paid. You do a visit, you get paid. So you can get down how is value-based care working, and I think there's a lot of challenges. We're kind of like I'd say 5 years in of a lot of health systems and a lot of practices trying this and building the rails to try to make it work, and it's been a mixed bag, but it still seems like it's the best way right now we know to try to solve this thing I'm talking about, which is it's just really hard incentive dynamics today, the way things work. So how are you going to change that when everyone now, especially this year, is focused on ROI, you need a business plan for everything, but you still have these weird dynamics, and if we don't like openly talk about it, you're not going to be able to solve it. And sometimes it's like it's people aren't super comfortable about it because they ultimately, everyone in the industry wants to do good by the patient. But then you have that has to jive with reality.
Yeah. So like maybe we could jolt people into getting comfortable with it, but saying like, imagine being in a system where, if nobody gets sick, then you go out of business. Then what's the incentive alignment there?
Yeah. So the encouraging things with the employers seeing the sticker shock or the government trying to help make it valuable business to take care of people proactively, to move upstream of illness, right? It's a sick care system today. We want it to get to be an actual healthcare and wellness system. And that'll always be part of it. There's always going to be this acute need of people getting sick, but we've got to do a lot better on the front end, and I feel like that'll get us there.
Exactly. And for the people that want to connect with you and follow you, I know you're doing a lot of coalition building. What's the best way they can reach out to you?
Ben at Tendo.com, and I'm at conferences like this at ViVe, and definitely help try to be accessible for any kind of partnerships that make sense with the entrepreneurs out there, or collaborating with health systems. We have the strategic customer model, so we really kind of go deep and broad with our health system partners, and we really like that. So I'm out there and always happy to discuss anything, and thanks for having me, Chris.
Of course, Ben, it's been a great conversation, and I think there's a lot of great learnings that people can start changing using to help change their organizations. And I want to follow up for the audience, for anybody who wants to dig in even deeper. I had a recent conversation with regard to the efficacy piece around evaluating these digital health solutions, knowing what's effective. We spoke with Dr. Quinn No. So she went deep into how they evaluate digital health interventions for their effectiveness while they're building that portfolio. So you can find that on our YouTube. And again, thank you, Ben, for spending some time with us.
Thanks. Take care.